Hi, everyone. We want to welcome you to our second webinar in our Creating Trauma Responsive Schools webinar series. This is Trauma-Informed Skills for Educators, Part 2, Trauma Responsive Skills and Strategies. My name is Kelsey Schmitz. I'm the School Mental Health Lead for the Northwest Mental Health Technology Transfer Center Network. And I'm located at the University of Washington Smart Center, the School Mental Health Assessment Research and Training Center. And next slide. This is just a quick disclaimer that the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. And as a reminder, we are doing 6 webinars, and this is our second webinar. We have some limited space. We're limited to 100 participants in our webinars, but we are recording the webinars, and you can access the links to the recorded webinars below. And the PowerPoint for this webinar was also sent out in the reminder for the webinar today. You can see on this slide that we have several more webinars, and I would just encourage you, if you see any that you are interested in, please go ahead and register if you think you might attend live. If you don't think you'll attend live, we've got about a 2-day turnaround before we get these posted online. So please hold those spots for people who might be able to attend live if you're not able, and catch the recording a couple days after that. All right, next slide. So I want to share with you just for a few moments about the Mental Health Technology Transfer Center Network. I know by reviewing the registration that some of you are located in our Region 10 Northwest Mental Health Technology Transfer Center, there in the upper left of the United States. But there are 10 other regional centers that also have school mental health supplements. So if you aren't in our region, I would encourage you to reach out to your school mental health lead in your region, or you're welcome just to reach out to me and I can put you in contact with them. You may also, no matter where you are, access the resources, tools, and materials that are being developed related to school mental health from each of these centers. And you can get that information by going to the MHTTC Network website at mhttcnetwork.org. You can search for your center, and you can search for other centers. You can search for trainings and events that you can join. There's also products that are being created. In addition to the 10 centers, there is also a National American Indian and Alaska Native MHTTC, as well as a National Hispanic and Latino MHTTC who have associated school mental health supplement projects as well. Next slide. So at our Northwest MHTTC, which serves the Region 10, that includes Alaska, Idaho, Oregon, and Washington, our goals are focused on providing direct training and technical assistance on the implementation of mental health services in schools, building infrastructure and creating learning communities, and supporting educational leaders to promote mental health for all. Next slide. So our key staff on our school mental health supplement at the Northwest MHTTC include myself, Megan Lucy, who many of you received communication from about the webinar, and our project director, Eric Bruns. Next slide. So we just encourage you to reach out to us. You can email either myself or Megan, give us a call. Please visit our websites if you're interested in additional information and resources. We have other webinar series. We have a monthly newsletter that we push out. So you are welcome to sign up for that newsletter as well. Next slide. So evaluations, these are very, very important to us. Not only are they required by our funder, but we utilize this information to refine and inform our professional learning opportunities. It just takes a couple minutes for you to complete these, and it really helps to communicate to SAMHSA the need that is out there for this type of workforce development support. These evaluations are voluntary and anonymous, and we will take a few minutes at the end and ask people to fill out the survey. If you have multiple people attending together to watch the survey, we just ask that each person fill out the evaluation, and we will put a link in the chat box, and you will also get a link in your follow-up email from this webinar. We would also ask that if you have questions that you use the Q&A feature that's below. We're going to be monitoring those and try to respond as timely as possible. But if we can't get an answer to your question during the live webinar, we will follow up with you. We had a couple that we did our last webinar, and so if you do have a question, we want to make sure that we get it answered, whether it's live today on the webinar or in a follow-up email. Next slide. So we are very honored to have facilitating these webinars our colleagues Vivian Villaverde and Pamela Vona. And at this point, I'm going to turn it over to them and let you hear a little bit more about each of them and the work that they're involved in.
Wonderful. Hello, everyone. Thanks for joining us today. Just to give you a little bit of background about who we are in the event that you weren't able to attend the first webinar. We're both here from the Treatment and Services Adaptation Center for Resiliency, Hope, and Wellness in Schools. We are a federally funded center from the Substance Abuse and Mental Health Services Administration. And our center has been around for over 20 years. And really, the original focus of our center was to develop what are now some of the most commonly used evidence-based practices for trauma, designed specifically for implementation in the school setting. And these may be interventions that you've heard of, like the CBITS intervention, Bounce Back, or SET. But what our center has really learned over the past 20 years is that while these evidence-based practices are absolutely effective at ameliorating signs and symptoms of trauma in our students, we also know that they're most optimal and most effective when they're implemented in a school setting where everyone has a shared lens. Everyone is trauma informed and everyone has the skills and knowledge to be able to respond to students in a nurturing, trauma-sensitive way. And so that's really what the focus of today's webinar is about, is how do we begin to disseminate that shared understanding and actually equip all school staff with skills to be able to respond to our students in a way that's trauma-sensitive. And I'll also let my colleague Vivian just introduce herself.
Okay, so again, my name is Vivian Villaverde, and welcome. Thank you for joining us today. And I am a part of the center, and I've been part of it for the last 3 years. And I mean, personally, my own training, I was trained to be a school social worker, and so I have been working with the Los Angeles Unified School District for about 10 years prior to coming to USC as a faculty. And then as a faculty, Pamela and I have been partnering with multiple school districts locally, as well as the California Department of Ed, in doing this and in training educators as well as paraprofessionals. And we're also moving into the security officers as well, the SROs and the school police. So that's something that we're working on, but really just supporting and consulting in terms of how do you translate the trauma information, the trauma knowledge into usable skills in the classrooms as well as in the campus as they interact. And so we're moving into part 2 of this training, which will discuss or address those skills and strategies. So I'll hand it back to Pamela, who will start our training.
Great. All right, so here it is. We're going to start talking about concrete skills and strategies for all of our educators. So now, if you were on the prior webinar, we covered the first 2 bullet points, which were to learn about different types of traumatic experiences and how often they might be happening in the lives of our students. And we also started to understand how symptoms and signs of trauma might manifest in the classroom. And so today, we're really going to focus on this 3rd bullet, which is, again, to enhance educators' ability to respond supportively with students who have been exposed to trauma and to build resilience in all of our students. And so really, when we talked last time, when we talked about SAMHSA's 4 R's of being a trauma-responsive school system, we covered realizing the impact of trauma and recognizing signs and symptoms. So in alignment with this definition by the federal government, we'll be working on the second 2 R's, which are to respond by integrating trauma-informed principles and to resist inadvertent re-traumatization of our students. All right, so let's just quickly review a couple of key points from the last webinar. And this is where we talked about what's happening in our students' brains when they experience an event that might be traumatic for them. And remember, we talked about this green area, the amygdala, being the region of the brain that detects threat and sets off an alarm when a threat is identified. And often what can happen is when that amygdala fires so powerfully, it can knock off other regions of the brain, such as the hippocampus and the prefrontal cortex. And as we discussed, the hippocampus is a region of the brain that helps us regulate memory and our emotions. And then the prefrontal cortex is the region of the brain that helps us plan, use logic, problem solve. So what does that mean? That means when we have an acute traumatic response, that means it's our survival brain, the amygdala, that's really responding to the event, and our thinking brain, which we think of collectively as the prefrontal cortex and the hippocampus, it gets knocked off, which has a very valuable, it happens for an evolutionary reason. If you think about it, it's because if we are in danger, we need to be able to respond instinctively. And that's why the amygdala takes over and our thinking brain does not respond in that situation. And then we talked a little bit more about our students who might be experiencing ongoing stress. And we reiterated the idea that our brains can somewhat be like a muscles, and the more we utilize a particular region of the brain, the stronger it gets. And if we're not utilizing other regions of the brain, they don't have the opportunity to be as effective as we would like them to be. And so for our kids who are in these chronically stressful situations, what happens is that survival brain, that amygdala, gets stronger and stronger and better at its job. But we know the unintended consequence of that is that our students' hippocampus and prefrontal cortex may not be operating as optimally as we would like that to happen. So let's keep that in mind. And we talked about this pathway, right? That if we have childhood exposure to ACEs and trauma, we know that can lead to what we call proximal outcomes, which are poor academic performance, emotional difficulties, and social impairments. And then in the long term, we know data shows us that this leads to long-term chronic health problems, lower rates of employment, and even higher rates of incarceration. So it's really our job to intervene as a trauma-responsive school in order to shift both the proximal outcomes, how students are doing today in their classes, in their communities, and into long-term life outcomes for students, which is better health outcomes, more stable employment, and lower rates of incarceration. So what we're going to do today is align our trauma-responsive strategies with the principles of being trauma responsive. And so in order to do that, we first need to think about this concept of resilience. And I'm sure this is becoming a really big buzzword, but this is the definition. Resilience is defined as the ability to effectively cope with, adapt to, and overcome adversity, stress, and challenging experiences. And I think we've all heard and all seen that not all students have the same level of resilience. Certainly 2 students can experience the same difficult experience, while one student is able to bounce back pretty quickly, another student may struggle longer. And so researchers have started to look into this to try to better understand why some students are more resilient than others, why some children are more resilient than others. And they've really broken it out into 2 types of factors. First and foremost, there are assets that some students have. And we think about these as really internal characteristics of the student. So these could be things like the level of intelligence they're born with, the temperament that they're born with, whether they have particular talents, and their level of self-esteem. And so these are things, some of these we have some control over, certainly helping support a student's self-esteem, but other internal assets we probably don't have as much control over, like their biological temperament. And then, of course, we look at resources. And these are the things in the student's external world. What is in their environment? And we know that there are certain resources that make a student more resilient. These include a relationship with a trusted adult, consistent and predictable rules, routines, and rituals, and having a sense of purpose. And so now let's talk about, and what we'll be doing for the rest of the time is talk about how do we incorporate this knowledge of protective factors into our work with students. And of all of the protective factors that I just mentioned, relationships are the most potent and most powerful protective factor for students. And, you know, I know it's almost become cliche at this point, the one trusted adult saying, but it is absolutely true and borne out in the science. And what we know is that our supportive relationships with students can actually serve as an antidote to trauma. In fact, it can help to re-sculpt our students' brains. And we'll show you a little bit about what we mean by that. And certainly, educators have the ability to communicate to students that they are safe and they belong to a community. And we're also modeling for them safe and trusting relationships. The slide is not, there we go. All right, so I'm just gonna quickly talk you through this research study that was conducted. And what it is you see on each of these little graphs, there's a time point 1 and a time point 2. And what the researchers did was at time point 1, they took a snapshot of students in the 8th grade and assessed their reading achievement, their math achievement, and their level of hope. And that's the time 1 snapshot that you see. And then a year later, they tracked all of those students again at their new school in the 9th grade when they had transitioned into high school. And what they asked each of these students and at the end of 9th grade was, did you feel supported by at least one person on campus? And what you'll see here is that for the students who said yes, they felt supported by one person at their new school, those are the students represented by the dotted line. Conversely, the students who said that they did not feel supported by someone at campus, those are the more straight line, the solid line. So what you can see here is that a relationship with a trusted adult improved students' sense of hope, and it improved their reading and math achievement. So then we have to start to wonder, well, how is it that a relationship can make a student better at math? How is it that a relationship can help improve a student's reading comprehension? Well, we have some information, and it is borne out in the neuroscience here. And you may now look at this and see that it's very different from the prior two slides that we looked at, where if you remember, it was the amygdala that was turned on and bright green, whereas the prefrontal cortex and the hippocampus were gray, meaning that they were not operating as optimally. So what we've learned is that close relationships help students feel safe and connected. And in fact, close relationships release the chemical oxytocin, which is a feel-good, connected chemical that helps us feel close to other people and feel safe. And what that chemical does is it actually turns down the amygdala, the survival brain. And in doing so, it allows the prefrontal cortex to operate more effectively, as well as the hippocampus. So this is some of the neurological basis for what we hear about when people say it only takes one trusted adult. Well, one trusted adult can help to rewire and re-architect a student's brain. We're having, okay. Now this is a great video that we won't be playing now, just for in case we don't want to run into any technical difficulties, but we encourage you to watch it going forward. And now I will turn it over to my colleague, and she will talk through the 6 principles of trauma-informed support.
Okay. Well, if you notice, or if you remember, Pamela referred to this in terms of aligning the skills and strategies to the 6 principles. So the 6 key principles of being of a trauma approach or being a trauma-informed system is number 1, safety, trust and transparency, peer support, collaboration and neutrality, empowerment, voice and choice, and cultural humility. So we'll get into each one of them in the preceding slides. So let's start with the principles, safety, the principle of being safe, providing safety. So when we talk about safety, it's all about providing an environment that feels safe to the individual. And so that includes physical safety, psychological safety, access to support, and modeling of calm behavior. So if you think about it, if that one particular relationship that provides that sense of safety can promote the reconnection of the prefrontal cortex and the hippocampus, just like Pamela has mentioned earlier, imagine an entire school system, a full environment where the individual, in particular the student, feels really, really safe and would have the opportunity to really reconnect and calm that survival brain. And then next, we are looking at trust and transparency. So trust and transparency talks about providing clear expectations, predictable expectations, and that's predictability, and consistency. So if we're going to create a trust and transparent system, we have to really look at our environment, whether kids or the students know exactly what to expect. If things go wrong, they expect that the adults are going to be there to address the situation and keep everyone safe. And also, if you're looking at classrooms, if you're looking at rules and discipline, that there's predictability and consistency, no matter who breaks those rules, the consequences or the response would be the same. So just think about that as we move forward with the rest of the strategies. And then the next principle is all about peer support. This applies to students and adults in terms, and also it is a foundation that we wanted to create for learning and collaboration as well. And as we look at peer support, we want to look at shared experiences that promote healing and well-being. And I just want to address this in terms of peer supports among students, but also peer supports among the adults on campus. Because if we're gonna do the work that we're going to do, we're gonna need each other. We're gonna need each other's support. And then the next principle that I want you to keep in mind as we move forward is collaboration and neutrality. And this is all about partnering with each other, leveling the power and the field in terms of being able to have the same contribution and the same voice as we move forward with the work that we're going to engage in. And then also we're looking at meaningful shared decision making. So if we're going to have a truly collaborative team and a collaborative system, then we have to look at opportunities for meaningful shared decision making. And then another one, it would be empowerment, voice, and choice. So as we look at this particular principle, we have to think about this in terms of the adults who are going to be doing the work, as well as the students who we're going to be interacting with. So providing opportunities for success, engage in decision making, encourage students to identify their own resource, and acknowledging success. So this is really supporting that notion of developing a trauma-informed lens instead of looking what is wrong with our students, acknowledging success, looking at what their resources are and what they can do and are able to do.
And one thing I would just quickly add about empowerment is that we know when a student is exposed to a traumatic experience, that can be a situation where that student, that child feels extremely helpless. It was a situation that they had no control over and wasn't able to deal with in that moment. And so when we give them opportunities to have more agency, to feel like they have control over their environment, that helps them to feel more confident and resilient.
Great. And then lastly, it would be cultural humility. So some of the things that we want to focus on when we're looking at this principle is learn about students' culture and let them define the context of their experience. I think this is really important. And one of the things that we have to look at is that not making any assumptions and looking at what groups they might belong in and assuming that that experience is going to be the same as everybody else. So even though they can identify with a particular culture, a particular subculture, we want to make sure that we're letting the individual experience come out as well, or validating them. Identifying strengths and assets of the culture, because again, looking at the resources that they might have, and remember the point in terms of protective factors, this might be an area that we want to tap into in looking at protective factors. And then next, understand inherent protective factors and coping mechanisms associated with each culture. And looking at, in particular, with the coping mechanisms, I think each subculture or each cultural ethnic groups might have particular practices and traditions, and we might want to look into those and tap into those. And lastly, we must be very aware of our own biases and its manifestation. So coming into this, have we checked in with ourselves in terms of our own beliefs and our own practices, and how much of those are we imposing versus how much are we letting the individual, particularly the student, define the experience and also share with us what would be the most effective way in dealing or in processing what has happened to them. So now that we've discussed the different principles of being a trauma responsive system, what we would like to go now is looking at fostering a trauma responsive climate. So as we look at creating a trauma responsive classroom, because we're looking at focusing in with our educators today, so we're going to focus in the classrooms. So as we think of creating that trauma responsive classroom, we want to look at a safe and calm classroom that are essential for learning. So is the student going to have a calm down survival brain so that they can engage the learning? So how do we create that? And then true for all students, but particularly important for students with trauma history, we want to make sure that they are connected as they come to the classroom where they're going to learn. And as the adult, we saw how important, just like Pamela has demonstrated earlier or discussed earlier, that creating that positive relationship by fostering a safe space with you as the adult, I think that would be very, very effective in creating that positive learning environment for them. There are strategies educators can employ to foster safety by identifying, eliminating, and minimizing the impact of trauma arousing events. And so in the next few slides, we'll look at what are some of the features of a trauma responsive classroom. So transparency and predictability. I think, one of the things that we're suggesting is that it is very, very important to make sure that the classroom is as unpredictable or as predictable as possible. You need to be clear with your schedule, clear with your classroom expectations, the behavior expectations, as well as the consequences, whatever they might be, for those behaviors that are not conducive to learning. So we want to make sure that we're doing that at the very onset of the school year. Because if you're going to try to have the clear expectations later on, then that might, their habits might have been formed already, and that's going to create some conflicts later in the academic year. So as soon as you're able to start your academic year, I think that's where we want you to have those clear and transparent rules and expectations, and discussing as much as you can of anything that might become of an issue in the classroom. So, kind of preempting things that might potentially arise so that the students know that you are aware that the classroom might have some issues, but you're on top of it, and that you're going to be responsive and you're going to be consistent with your response as well.
And the other key rationale for this is because we know that many of our students aren't living in homes or communities where things are transparent, where they can predict what's going to happen next. And so that's when we know their survival brain is really active, because they don't know what to expect most often in their home or in their community. So in order to bring them into an environment where they do know what to expect, both in terms of how the day is going to proceed and how they're going to engage with their peers and with staff, that helps them to know what to expect and to therefore calm down that region of the brain that's really hypervigilant and seeking. They learn to expect the unexpected, and we want to help them understand what to expect.
And just to impress how important this particular factor is, I actually teach graduate level students. But in the beginning of each of my class, each fall, I've actually created a system where I've had each student write on a Post-it paper some of the rules and expectations that they expect from each other for the entire class, and I have them sign a contract in the beginning. And again, these are adults, and it makes it so easy for me, especially in the use of social media with adults, in terms of coming back and reminding everyone that we all signed a contract and that we're holding each other responsible in the consistency, the predictability, as well as the safety in that classroom. So no matter how old your students are, I think these are just opportunities to empower them to be part of that rules transparency, if that is something that you're able to do, but also to hold each other accountable for it, especially when they're not used to having rules and expectations and having been exposed to chaos all the time. Classroom layout. So we want to look at entrances, exits. How visible are they? How accessible are they? Is it easy to get out? And we have to look at some of the students who might actually respond to knowing that there is an exit for them. So some students might not be comfortable not having that escape route. So we want to make sure that we're paying attention to those particular students who might feel so much more safer when they know that they're closer to those exits. So looking at proximity and who needs that type of proximity. And then some students may not like having students behind them. I know some of us, this might be a real challenge, and so we have to be really creative on how far you're going to sit the students, how far from each other, how close to each other, and who cannot sit in proximity of you. So those are the kinds of considerations that we might need to look at, as well as adequate personal space in the seating arrangement, and not only while they're sitting, but when people are walking in the aisles in between desks or in between seats. Because some of them might be experiencing some hypervigilance, that if somebody's walking to them too closely, that they might impulsively react to that particular proximity. So we have to look at that. Look at sort of also the stimulation factor in terms of the busyness of the classroom, the busyness of the desk. So depending on your group, depending on how much you know about the students, these are the kinds of things that you might want to consider as you look at your classroom layout. Subject matter. I really like this particular strategy, being able to pay attention to it and really, assess what are we putting up in our walls. So we need to be mindful of potentially triggering classroom signage. As you can see on some of the examples that we have, we need to look at the subject matter. We have to also look if they're welcoming or inclusive. And we also want to look at how empowering they could potentially be. So as you can see on the example on the right, there's one all about potentially either physical assault or sexual assault. And so would this be triggering, or would this be a reminder for potentially for some of the students that might have had experience with physical, verbal abuse or sexual abuse? And then here you have the Desert Storm poster. Are some of our students struggling with family members who have been deployed many times or currently have come back and are struggling with reintegrating back into the family? And then look at that multicolored hands in terms of, having signage that are welcoming to all types of students, as well as promotes inclusiveness and equity. So these are the kinds of things. And I know that some of them are subject matter related, like science classes and things like that. I know some of the health classes might have some cancer or some particular disease poster. So we might want to look at that, especially if we have students who might have a family member with a particular illness and are currently going through that kind of difficulties or stressor.
Yeah, and so when we do know something, like for example, if one is a science teacher and they know they're going to be teaching the science of cancer cells, but they certainly know that they have a student who has a family member that's dealing with that. I mean, ideally, teachers can engage in what we call a check-in and check-out to let the student know in advance that this is the subject matter we'll be talking about today. It could be upsetting. I'm here to support you, or if you need support, please let me know. And also kind of checking in with them after class. How did that go? Is there someone you'd like to go talk to? Of course, we can't always know whether the subject matter that we're teaching or the issues we're addressing serve as a trigger, but we can always be mindful that there are things in the environment that can unconsciously be causing our students to go into that survival brain mode, and we need to be mindful about those things.
Yeah. And so one of the things that I really want to point out, as you see, we're looking at the classroom climate here, but just by engaging in all the activities that we've suggested in terms of discussing it, having the students provide information, whether this is a reminder for them, giving them the opportunity, you're already engaging in the principles that we've talked about: safety, transparency and predictability, empowerment, cultural humility. So as you can see, and within that classroom, creating that trauma responsive classroom environment, you can apply all that principles that we've talked about earlier. And then also looking at external stimuli. And this one we don't have control of, but we definitely need to pay attention when outside stimuli are happening, particularly if your classroom is by a major street, which in a lot of the urban schools, that is most likely to happen. So sounds of sirens, car brakes, bikes, maybe a fire truck or an ambulance passing by. So looking at who might be reminded of a particular stressor or traumatic experience, looking at the reactions of the students when these types of stimuli, external stimuli does occur. So just in particular, one thing, I mean, it's easy to overlook these things. So if you have a student who is not acting their usual behavior when there's a sound like this, then instead of like looking at them as not paying attention, but really, you know, having a sense of curiosity, what is really going on? What might be going on? And then, you know, sort of exploring an opportunity to connect with that student and see if there are additional supports that they might need. So just as an example, at the Broward, when that shooting occurred and everybody came back to school, the school district did not even think about it, but they, you know, kind of resumed as usual in terms of their bells and ringing the bell in between classes. But as soon as they rang that first bell, the entire school just went into chaos. And it's because, come to find out, the whole time that the incident was happening at Broward County in Florida, the bell was ringing the entire time. And so they had to come up with an alternative. So up to this time, according to our colleague who's supporting Broward right now, they have not used the school bell to signal changes in class time. So they actually had to make sure that they come up with an alternative. So it was sort of a hard lesson learned for all of them, because they had to do a lot of debriefing that first day that they were back. Okay. Expectations for peer-to-peer interactions. So this is another one. We've kind of mentioned proximity. We mentioned about that. And then we looked at peer supports when we talked at the principal. So fostering our collaboration, create a culture of support, of collaboration, and then set clear parameters. And again, that talks to safety, transparency, and empowerment. And then being mindful of students' conflicts when making group assignments. Who are we grouping together? Are we looking at who might have some conflict history, and how, you know, productive would that be in putting them together for certain class projects and activities? So we have to be aware of all of these things so that as much as possible, we can prevent any potential conflict or disruption in the classroom, and just being very aware of it on the get-go, on the onset. And then educator-student interactions. This involves students in decision-making power. So anything that you're gonna do in your classroom, if it's one of those things, consider empowering the students, or consider including the students in the decisions and providing their input, and so that they have ownership of their classroom as well. So that's why the example that I gave you, where I had the student put in a poster, write in a poster note, and put in a board, those are the exact words that I embedded into what we were agreeing on for classroom expectation, because I want to make sure that the elements that are important to them are included. And then looking at physical space, the stands, and if you notice on the picture, on the image, the adult is standing behind the student. So we have to be aware, if this is something that could be a reminder of some sort of a traumatic event for them. So is it better to approach in the front, on the side, or is the student okay with this? And so not taking it personally when students are not responding in our proximity approach, that potentially it is because of some experience that they might have. And then again, tone of voice is very important as we communicate. And again, our students are so used to conflict, maybe conflict-inducing voices, loud voices. And so how do we create that calm? And so modeling that, as well as being more effective in our communication with the students. Calm corners. This is one of my favorites as well. If at all possible, part of the predictability and the expectations that we want to create is creating a calm corner. engage student senses through touch, sight, sound, those bendable balls, their squeezable balls. If you see one of your students starting to escalate a little bit and become dysregulated, what do you have in your classroom that they can, that you can actually support them and have them moved aside for a bit of a time so that they can engage in self-regulation? How are you going to teach this? How are you going to provide opportunities for this? So this is really important, excuse me, to consider. So some of the things, if you can afford it, if there's space for it, looking at a calm corner potentially. It should include objects and activities to engage student senses, coloring, so tactile stuff, visual stuff, as well as auditory calming opportunities. Set clear, calm corner parameters as well as expectations at the very beginning of the school year. It'll be really hard to set this up in the middle of the year or anywhere after the beginning where there's already a pattern that's been developed. So it's really, really important to set this up. So some schools are being very, very creative about this. So I think one of the things that we suggest is like having this discussion with your colleagues and your peers, because I think what we find out every time that we do this training is that some of the teachers in your campuses are engaging in this already, but they're just not talking about it. So these are great way to really collaborate and share each other's practices. And then another thing that has been done in Las Vegas, because of the MGM shooting, one of the schools that we worked with, they actually wrote a grant to Kaiser and asked for money so that they can create a calm and mindfulness room. And they've covered it in those puzzle foam pieces so the floor is soft. They have yoga mats, they have fuzzy, different tactile, different texture pillows, as well as a video playing mindfulness activities, yoga, music. And so they've created a culture at the school that if they need a 5-minute break, that they can ask for it and they can get a pass or be escorted to the mindfulness room. And students started effectively using them so that they could prevent any type of big blow-ups. And so what they've also discovered is that teachers are also using it. So it's become a shared space for both adults and students as well. So that is a definite culture shift for that school.
Yeah, and I just want to emphasize the calm corner rationale is really based on two things. First and foremost, we want our students to be able to start identifying signs and symptoms of dysregulation in themselves. So if they realize they experience some fidgeting or some anxiety in their chest, they're able to communicate that, maybe it would be a good time for them to go to the calm corner and engage in some calming activities. And additionally, the other piece of it that we know is that when we engage in some of these sensory activities, that has a calming effect on the survival brain. So it leverages both that self-knowledge about their own signs and symptoms of dysregulation and the science around regulation.
And just, as Pamela changes the slide, I just want to kind of remind you, remember in part one, we talked about Bruce Perry. And one of the things that he's talked about is that some of those repetitive motions and activities the student engage in when they're dysregulated actually creates that calm and provides themselves its opportunity to reconnect, calm the survival brain, and reconnect the prefrontal and the hippocampus as well. So those types of activities really provides opportunities for the students to learn how to self-regulate. We're just making sure that we're actually cultivating it and really tapping into those protective factors and empowering them to do it, to engage in them.
All right, so in the next part, we are going to talk, well, first I should maybe take a quick break and see if we have any questions. And I'll just quickly check on our chat room or if our partners.
Hi, Pamela and Vivian. We don't have any questions yet, but I wondered if you could take just a couple moments to address the concern around active shooter drills.
Yeah, so this is certainly something that's receiving a lot of attention and that our partners at the National Child Traumatic Stress Network are trying to better understand and resolve. But again, we can have, you know, any of these drills, whether it be a fire drill, whether it be any other kind of drill, they need to be conducted in a way where people understand the neurology of trauma and people understand trauma reminders. People understand how students can be triggered. And so certainly doing things in a way where we maybe know in advance students who are more likely to be triggered by an event, notifying them in advance, being able to support them afterwards. We need to put a lot of those protections in place so as to prevent dysregulation in vulnerable students. And I'll let Vivian chime in as well.
So one of the things, I think now that we've discussed the principles of being trauma responsive as a system, we can always fall back into those principles and looking at the safety to predictability. If we're going to do any types of drills, and I agree with Pamela that it's not just a shooter drill, because if you think about it, in Paradise, in Northern California, because of the devastation of the fire, those individuals, the kids and the students and the adults are not going to experience fire drills in the same way again. And so are we talking about it beforehand? What are the conversations that are taking place? And are we debriefing and talking about it afterwards as well? Because I think given the opportunity to know exactly what to expect, what's going to happen is part of what we need to look into if we're looking at safety, predictability, empowerment, and providing them opportunity to ask questions and also have the safety net afterwards to be able to debrief, have the discussion. So NCTSN actually came up with a publication, that's the National Child Traumatic Stress Network, of providing a guide in terms of for parents and for the educators as well, in terms of conducting drills and what are the discussions that should take place. And I think the communication needs to also be extended to the families, because those students are going to come home and the parents are not prepared to have the conversation, or they don't have the conversation information to utilize. And so I think sending information beforehand as well as afterhand, and then provide after the fact, and also providing the parents maybe some talking points, providing them information might be really helpful. So I think that's, we can definitely forward that to you so that you can send it to all the participants.
Thank you. I actually was able to find it and I'm putting it in the chat box right now.
Great. All right, so next we're going to move into how we're communicating with our students. And one of the things that I hear from teachers all the time is that in some cases they really avoid engaging with the student, especially a student who they know has experienced the trauma, because they're so scared of saying the wrong thing, saying something that might trigger the student, might upset the student. And what we're here to do today is provide you with some really concrete strategies for supporting these students in a way that still falls within the scope of your practice. We are not asking teachers to become counselors or school social workers. So what these trauma responsive communication strategies are intended to do is they are intended to enhance that sense of connection that we talked about at the beginning of this presentation, that we know when a student feels connected and safe, that they're able to turn down that survival brain and engage better in the classroom. And so that's what these specific recommendations are intended to do. And so first and foremost, we're going to talk about attunement. And so first and foremost, there's two ways that we can attune to the student. And that really, there's the term that helping a student feel felt. So this is not just attuning with them at an intellectual level, at a cognitive level. It's really about engaging with them at an emotional level. So first and foremost, there's ways of validating a student. And a validation is something that recognizes, encourages, or reinforces that a person's feelings are valid or worthwhile. So that doesn't mean that we necessarily agree with everything a student says. They might say something like, no one in my family cares about me. We don't necessarily, some teachers may want to immediately jump in and say, well, that's not true. Your family cares about you. Instead, what this is about is saying, I understand that it feels that way. And so the idea is that you are appreciating their emotional experience, not necessarily agreeing with it, but appreciating it. And certainly identifying instances where we know a student is doing something really well. So maybe they have some stress at school, but we might be able to say, I know there's a lot going on, but I'm glad you're here. You've worked very hard on that. I'm proud of you. Now here's the conundrum, is that most often the students that are most in need of validation are sometimes the ones who are hardest to validate. It's hardest to find something to validate in them. And so that's why this can be extremely powerful, because a lot of those students may not be getting that level of validation at home. And so it can be extremely potent when they do receive it in school. And then there's this idea of simple reflection. And this means staying really close to what a student has said and just in some ways rephrasing it or repeating it back to them. Again, I recognize that for some of you, this might seem overly simplistic, but again, what we're trying to do is communicate to them in a way that enhances connection. And it might feel a little bit awkward, but it's incredibly powerful, simple tool. And so a student might say, I really want to leave today, everyone's on my case. And you just might be able to reflect back, it's really hard for you to stay here today, right? And so again, that might seem very simple, but the idea is that, they're so used to getting pushback, right? They're so used to being told that they're wrong or they're incorrect or that they're doing something wrong, that it can be very, very healing to know that what they're experiencing makes sense and is understandable.
And remember when we talked about in terms of making sure they're being heard and that we are validating their own individual experience of the situation. So in light of that, with a simple reflection, you're just letting them know, I hear you, and am I hearing you correctly as you reflect back? Is this exactly what you're trying to tell me? And so I think there's power in that in terms of really giving them the control on how to let you into their experience.
Reflection of feeling. Here's why this is so valuable. Dr. Dan Siegel, who many of you may have heard from, he started the Mindful Awareness Research Center at UCLA. He has this phrase called name it to tame it. And I really like that because the idea is that when we are able to name what we're experiencing, we inherently have a little bit more control over it. And so when we help our students identify their feelings, it helps them to feel a little bit less out of control. So for example, a student might say, I really want to leave school today. Everyone's on my case, but I know if I do, I'll get in trouble. And sorry, this is on the wrong. I don't know why it's, oh, there. This is, sorry, we had to. So the idea is that everyone's on my case. And you may say to them, you seem frustrated. You're feeling overwhelmed. So not only does it help them identifying it, it helps them know that what they're feeling is okay in the moment. And so that can be very empowering. And again, helping them feel connected to you and helping them feel understood by you. And this was the slide that I was just previously on, a double-sided reflection is also a strategy for helping them to identify their ambivalence about a situation, something that might be confusing to them. On one hand, I feel this way, on another hand, I feel this way. And again, just reflecting back that sense of confusion or that sense of ambivalence helps them to see that maybe it's not so wrong that they have these complicated feelings. And that is, I think, particularly valuable as adolescents start to experience a more complicated world. And we know that things are nuanced. And so to help them see, like, yes, the situation that you're in makes sense. I understand the difficulty that you're having right now. I understand the confusion you're feeling, and that makes a lot of sense. Again, is just designed to not fix their problem. That's not necessarily what we're here to do. We're here to help them understand that we appreciate what they're dealing with and we want to be supportive of them. And so the reason that some of those techniques that I just outlined might feel a little bit awkward is because we've all gotten into our own communication habits. So for example, given our role, we might be in the business of maybe giving advice or making suggestions. That feels like our role as helpers or as educators. But that doesn't necessarily serve the purpose of enhancing connection. Also, something like persuading with logic or arguing or lecturing them. Here's the situation, here's what you need to do, this is what makes most sense. Again, that might be useful in some situations, but really with our students who are exposed to trauma, it's not helping them to see that we understand what they're dealing with. And we know that for some of these students, because their prefrontal cortex is not operating as effectively, the idea of trying to persuade with logic and engaging their prefrontal cortex may not be the most effective approach for creating that sense of connection. So I really like this slide because I think it gives everyone the opportunity to reflect on different communication strategies that we've all developed, good, bad, or indifferent, and really identifying the ones that may serve as a roadblock to facilitating connection with the student. Because again, we know that connection is so important to re-architecting the way their brain is operating in the classroom setting. Now, another thing that we can do is normalize what's going on for our students. Again, for a lot of our students, especially those who are routinely being exposed to different traumatic experiences, the world may feel like it's out of their control. They may not be able to make sense of things. So what can you as an educator do to help them manage all of those different experiences and feelings? Well, one of the most effective things we can do is help them to see that what they're experiencing is actually quite common based on what they've gone through. And so now that you as educators understand the signs and symptoms of trauma and why certain emotional, cognitive, and psychological reactions result, we can help them to understand, yep, you're having difficulty sleeping, that makes sense given what you've experienced. And so of course, what we want to do is consider the student's age and their understanding of events as we talk to them about that. And we want to educate our students and our parents about what they might expect emotionally after experiencing something difficult, and also the kinds of behaviors that might manifest. So the example I just gave, sorry, I'm late today, I didn't sleep last night. And again, you can just respond by saying, that's pretty common. I don't have my homework, I couldn't do it. If we know a student has recently gone through something very traumatic, we can say, you know, it can be really hard to communicate, to concentrate after you've experienced something scary. And then thirdly, the other thing we want to do is facilitate their sense of empowerment. And again, we talked about earlier why this is so important, because we know our students who have been exposed to trauma have been in situations where they've felt extremely helpless, where they had no control. And so when we're trying to support our students and talk to our students, are we identifying ways to empower them? And this can be done through identifying resources and protective factors or helping them problem solve. So we can ask them questions like, what's been helpful in the past when you've had a hard time sleeping? Can you tell me what you think would be easier for you to get your homework done? You're collaborating with them as they work to manage some of these difficult situations. And again, you're not fixing the problem for you. You're not engaging in any type of clinical conversation or therapy with them. You're simply trying to help them identify their resources and assets. All right, so this is probably the module that teachers want to hear most about. The process of de-escalating a really difficult experience. Because I know some of those examples in the communication module may not have seemed as difficult as some of the other types of conversations that we have with students. And so there are really 4 steps to de-escalating a difficult interaction with a student. All right, first and foremost, it is teacher self-regulation. Now, we can only engage with our students from a place of calm, right? And we know that if a student is dysregulated, what does that mean? They're in survival brain. That amygdala is firing, and the prefrontal cortex that's responsible for problem solving and logic, that is offline. So we need to be, it can be really hard to stay regulated when a student is really dysregulated. We know that there's this concept of emotional contagion, and we often take on the emotion of someone who's in our environment. And so that can be difficult. Additionally, here's the reality is every day a teacher goes to work, they go in with their own past experiences, as well as their own set of current life stressors. And so we really have to be mindful of the things that are likely to get us dysregulated and to be prepared for them in the moment.
So continuing on with self-regulation, we want to look at, are we reflecting? Are we aware of our past stressful or past trauma experiences as well, just like Pamela said earlier? And then what are those current stressors? So I think checking in with ourselves prior to leaving our car from the parking lot and getting into the classroom is a good practice to have. What have you dealt with prior to coming to the school? What your morning has been like? What has that been like in your household? And then the commute. As LA residents, we kind of have to debrief as we leave our cars because it's quite different for us. But again, each and every one of us have particular commute experiences. So public transportation versus whatnot. And then self-regulation strategies. After our check-in with ourselves, what are we doing? And when we say self-regulation strategies, looking at it from the immediate as well as on a constant practice perspective. So positive thoughts. As you approach a current situation, engaging in self-talk, I can manage this, I'm prepared, I've done this training, I have some communication skills I can use, and I understand where the student is coming from. So these are the kinds of things that you can engage in. That's what we meant by those thoughts or mantras that you want to sort of fall back into as you approach those particular situations, that it is not about you and that the student is going through something, and tapping into that trauma knowledge that you now have. And then grounding, noticing the details of the setting that you're in. Ask yourself, what's today's date? So grounding in a way that it's, kind of reminding yourself too that this is what I have in front of me, and then not worry about what is next on your plate as you're approaching the situation too. It's like, what is fact-based maybe? So this is Johnny. John is dysregulated. Johnny is upset right now. And so just kind of looking at those sort of more tangible things to focus on as you approach the situation. And then as you look at also like practices, meditation, also some relaxation techniques, deep breathing. So what are your self-care practices too? So as I mentioned earlier, as you're looking at self-regulation strategies, we're talking about as you approach a particular volatile situation, as well as your prior practices that creates that sense of calm and regulation that you can always tap into when you approach challenging situations. Excuse me. So,
okay, so while Vivian takes a sip of her water, I think the most important to stress in this first part of the de-escalation process is that we're not going to be very good at maintaining our calm unless we are practicing that on a routine basis. You can't call on your own self-regulation strategy if you haven't practiced that strategy. So the more you're engaging in on your own or as part of the classroom routine, meditative techniques, managing self-regulation, you'll be able to call upon that skill if you need it, if you've practiced it. Whereas it'll be a lot harder to stay regulated if we're not practicing those self-regulation approaches.
Okay. So in terms of student regulation, so once you've been able to really connect with yourself and attune with yourself that you're ready to approach the situation in a calm way, then we can now look at addressing the students' dysregulation as well. So because the student's prefrontal cortex is not engaged optimally, remember the brain, the stress response brain, it's the survival brain and the reasoning prefrontal and the emotional regulation of the hippocampus is not working. So the students is triggered. And the reason that they're not successful right now and the reason they're engaging in this behavior is because they're re-experiencing whatever trauma that they have. So the students is in that flight or fight response. It's activated. And so us knowing that and approaching in that way, we know how important our regulated approach would be. So the key thing is to help them understand that they're in a safe and supportive environment. So we love our new illustration with this student being held you know, sort of in a calm and safe way by these two hands. So as we look at student regulation, looking at some of the strategies are grounding, looking at how do we keep them, how do we look at staying in the facts, staying in the moment, and not really engaging them in any kind of reasonable or analytic discussions because they're not able to do that. So ask the what, the why, you know, the who, and looking at that. And then also looking at potentially, you know, reminding them of some of the relaxation techniques that you've taught them in your calm corner. That's why those kinds of things are really important because then it's easy recall when they're dysregulated. Distracting them, redirecting the students, drawing, again, engaging them in this calm corner with their other stimuli, just auditory, visual, as well as tactile calming activities. And then modeling. So that's the part where it's so important for us to be regulated when we approach our students who are dysregulated because you want to model that. And then you can also engage some of those communication skills that Pamela have talked about. Just simple reflection, not asking for details, but just letting them know that you're hearing them. No, the students, the more you provide the students practice for it, the better that they can have recall and utilizing those calming and relaxation techniques as well. So what you're trying to do is really attune, like encourage attunement back with you as the adult. Students are still in the process of calming. They're not ready for a full deep conversation or analysis of the situation. It's just reconnecting back with them. You're not you know, they're not ready for the problem solving, but just affirm, validate, use the communication skills, the non-judgmental communications. Because again, just like what Pamela said earlier, when seen, heard, and understood, people shift from stress to rest. And so we want to calm that amygdala. So resolution, when a student is calm and cognitively available. So this is when they can have that eye contact with you. They're calmly breathing now. There's an expression of curiosity. There is a two-way conversation. That's when you start to look at what's happening. But you don't want to go to this part, to this sort of resolution part until they're attuned and they're a little bit more calm. So resolution, again, what we want to say is that when students are dysregulated or they've engaged in a behavior that's disruptive, we don't want to disregard any of the discipline policies, but we want to make sure that they're understanding why, you know, we're understanding first what they're upset, engaging their current feelings, as well as discussing with them clear expectations and actions. So it's important that you have the predictability, the transparency, and the consistency, because then you can have this discussion without the student not expecting it. And so that creates that safe response. Encourage them to continue the reaction with you, but it's not on a punitive, but there is a consequence, but also there is support and additional supports as needed.
And just a couple points as we end the de-escalation part is that first and foremost, your ability to help regulate a student is going to be very dependent on the relationship you've built with them to date. So all of that upfront information that we gave you about resilience, about connection, about how to communicate in ways that enhance connection with the students, those are all going to serve you well if you need to subsequently de-escalate a student. If you've created emotional safety with them, they're going to more easily dysregulate or regulate with you than if you don't have a very strong relationship with them at the outset. Mm-hmm. And then this resolution piece is really an opportunity to strengthen your relationship with them. For the student. They may never have experienced a situation where someone is still caring for them and engaged with them even after they've done something that was disruptive or difficult. And so this can be a very powerful part of the de-escalation strategy. Back on now. Oh, so we're PowerPoint here. Okay.
You're good. You just cut out
right.
for a moment.
Sorry.
We didn't have any sound from you, but you're back.
So finally, we're just going to get through this really quickly because I know we lost a few minutes with our technical issue. But what we need to do first, not first and foremost, but what we need to be consistently doing is operationalizing and utilizing these principles as we engage with our fellow staff members. So this really is important because it sets the tone, it sets the culture for how everyone engages on campus. So how we talk to colleagues about a student can really set the path for what supports or actions will be taken. So if we're talking amongst one another and engaging and talking about a student who may be difficult or a troublemaker, we may be more likely to engage in some disciplinary action with them. Whereas if we're engaging with our colleagues in a way that's trauma sensitive, and we know that they might be showing signs and symptoms of stress or trauma, we're then probably more likely able to identify the appropriate resources for them because we recognize that trauma might be involved. And so we want to talk about these trauma-informed referrals. And so what you really want to do is keep in mind our trauma-informed principles and identifying strengths and protective factors that a student already has. When we are maybe engaging with the student and caregivers about resources or disciplinary privacy. And then finally, how staff collaborate to support one another is particularly important. Now, we know that educating can be one of the most difficult professions. We know that the demands can be overwhelming. So what are educators doing to support one another? And guess what? It's not a whole new set of skills. All of these skills that we talked about, affirmations, validation, reflective listening, normalizing, empowering, are we doing that with our colleagues? Are we understanding when they're having a particularly bad day or having a difficult time relating to a student? Can we help them understand that, validate that, normalize that, and then help support them moving forward? So when we're able to collaborate that way as staff, we're able to set a model for our students in terms of how to collaborate.
Mm-hmm. So in terms of, what would be ideal or what we're striving for is that having that staff collaboration and mutuality, that all of us are empowered to utilize all the skills and to be really trauma responsive as a full system. But then also create enough collaboration and mutuality that when a student travels through our system, that they're going to receive the same consistent message as well as the same consistent support and responses from everyone. So that one staff's response, trauma responsive action, is not undone unintentionally when they move to another staff at that school. So we want to make sure that, we want to encourage that kind of collaboration.
Great. And so ultimately, when everyone has this shift in perspective from what's wrong with this student to what has happened to the student, we're really able to engage with one another and with the student and their families in a way that is far more supportive and effective. And then we hope will change this trajectory of students, improving their social emotional wellness, their academic achievement, and leading to better lifelong outcomes for students. And so I don't know, we have 5 minutes. I know Kelsey probably has some business to manage.
We do.
Or we can take some questions.
We don't have anything, we don't have any questions right now. So I can go ahead and do the wrap up. But just want to thank you, Vivian and Pamela, for the amazing presentation today. Despite the technical difficulties, you're just true professionals. The show must go on. So as we wrap up today, just want to, and if you could advance the slides.
Yeah.
Thank you. Here's the information, contact information for Pamela and Vivian. Our next webinar is actually February 12th. And there are 20 slots left. We just took a peek at registration, so there's just a few spots that are left for that. If you signed up and can't attend in person, now you can cancel that registration and open that spot up for someone else. I believe Megan has put the evaluation in the chat box. So if you want to go to the next slide, just a reminder, we'd just be eternally grateful if you'd take a couple minutes and complete those evaluations. And if there are multiple people with you, if you could each complete one, that would be really helpful. It just won't take you but a couple of minutes. We will be posting all of the material on the Creating Responsive, Trauma Responsive Schools website. I'm not sure if Megan has got that in the chat yet or not. But we will also be, oh, there she is. You can find the recordings and materials for all the 6 webinars as they become available. We'll be posting everything to that page, including the recorded webinar today. The webinar from the first presentation has already been posted, so both the recording and the PowerPoint have already been posted there. You can access those things. As a reminder, sign up for our newsletter, reach out to us if you have any questions or want to know about future events. And I think with that, we will put an end to today's webinar. We look forward to seeing you all back here in February, and hope you have a great rest of your day.